You mentioned that when you moved, to the Ministry of Foreign Affairs, that you definitely wanted to have well-being also under the umbrella of health. And Finland is known for being a kind of the happiest country in the world. How do you see that assessment? What does it mean through your eyes?
Yes, thank you for a question. And it is like sixth time in a row we are ranked to be the happiest country in the world. And one thing is perhaps that, and I think that, and it has been also analyzed that one reason for that is that people in Finland actually can trust that if something happens to you, like you get some disease, mental health problems, burnout, or be it then cancer or whatever happens, or divorce happens, and or unemployment or something like that. That then there is help available, so that then comes the society. Then you get the taxation you have been paying, the tax quite high taxes we pay here, so we can then get back. There is that trust that the society will then be there and there will be help, and that is I think that one reason, and also that we have then universal health coverage kind of, because there is in our constitution for everyone here in Finland there is right to get those social and health services that they need, and also then education. Everyone can get then education, and university education is nearly free here, and so that this is one reason I think that this society has been for decades built on that kind of values, that our parliament and politicians and the system in Finland then wants that everyone living here in Finland would have then possibility to have their potential into use, and then we have quite open discussion in our society. If I think about the secondary use of the data legislation, or the one that we have been preparing and not have succeeded yet, then get through the parliament, the legislation for genomic center or genomic data use. So there, of course, we can use it under the GDPR and secondary use of data, but we have planned to have a more detailed legislation for that use. But there have been very open discussion, public discussion, while we are preparing our legislation also. So I think, and of course, it's so that you never have a possibility where everyone is 100% like pro. Yes, this is really good. But we accept then that when we have get agreement of something and have majority behind that, so then we can go forward. Every day you have to do and earn that trust that comes from your population. One thing I would like to then point out here also, why we have been succeeded so well with the digital transformation. We have been ranked last year, 2022, inside EU #1 regarding the digital society and digital economy. It's so-called DESI index. That shows that our society is really digitized, and people have the knowledge how to use digital tools, but we have also infrastructure here, and being able to then offer a lot of services, public services, for example, digital services. And to be able to do that, we have used the data we have then collected since 1960s, which is then in different kind of registers, and there are legislation behind those registers, and also public authorities who take care of them. For example, our National Pension Institute National Insurance Institute is taking care of our Kanta archive, which is where the health data is then stored. there is taxation register, population register, and so on. This has been used so that the digital services that have been offered to our population using this data, which is in the registers, have been helped a lot our everyday life. So that has been then the way we have been building then the trust in our society, and people have been asking also health services to be digitized. And that's why we got through also the legislation for secondary use of data. So this has been, the trust building is really important if we think about digital future use of new technology. But we have had a lot benefit from our society, which have been built on equal possibilities for everyone.